Crack pressure, guys.
Want to get the monitor out so we can get
Grab it, Springs.
You got it already?
Yeah.
Okay, let's get a capnography, you guys. I'm gonna start CPR.
She lost pulses too?
No chilling any pulse. Up is up.
Very faint.
Can we grab it? Let's grab the oxygen, you guys.
Hey.
Epiatropine, IV.
Where's our jump
Por
bag?
favor.
Grab the bag and
in
hold
place
her
already,
bag
yeah?
up.
No, where's our jump bag?
And Mike, if you want
It's
to.
right at the exit of the chicken coop.
I saw it right there. PEA.
PEA. She done that with a CO2 of 11.
Battery 1's low.
And battery 1's low.
You pushing Epi right now?
Okay.
I'm not
You want a
seeing it.
capnography reading?
Epi's on board.
11.
No, don't go wide open.
She's been well coded.
Yes.
She's pushing, so as soon as she's done. 2 Epi, 2 atropine on board.
Okay, great. Full compressions.
T's for possible.
All right, we're in a neurocomplex rapid rhythm. We have pulses.
And if so, a blood pressure.
Anybody got a cough?
She took a breath.
She's got a carotid.
She took a breath.
I feel her heart beating in her
Yeah, we
chest.
got really good pulses, you guys. Really good pulses.
Get her blood pressure cuff.
Yeah, let's get a
BP
blood
cuff.
pressure.
Right there, right on top, right
She's
on
got
top.
radials. Let's not get a blood pressure. Let's just go to her.
Okay.
I think we put her in here.
Put her in
You got
the
it. Yeah, 'cause you got it. The big
All right,
house
put her in
thing.
the ambulance.
And lights.
She's got radials. We don't need to take a breath.
Awesome breath.
What's your call, my friend?
Nice.
charge. What are we doing?
spontaneous.
Get her in the ambulance and take her to general.
General?
Yeah, get in the ambulance, take her to general.
Man, this battery's good here.
Are there any good medics that can go?
Praise God. Let's keep going. Okay, you're good?
Okay. Back up.
All right, cradle up.
Wheels up. It's got to be direct because I have no idea where it goes.
And ventilate. General.
Just praying. I think that actually did some good.
Scott, you have a stethoscope with you? Okay. Awesome.
Yeah, exactly.
So this 45 around age-year-old female came in last night. Her leg was partially amputated by having a crush injury on it. Brought her here to the compound. They did a full amputation of her lower right leg. Over the night, she got steadily worse. She was very hypovolemic. She lost a lot of blood, both to trauma and during surgery. They watched her overnight. Didn't actually expect her to make it through the night. Woke up this morning. She was feeling a whole lot better, so they were going to transfer her down to the general hospital to get some more definitive care. And on the way out to get her transported, she did go into cardiac arrest. She did stop breathing. Her pulses stopped. Thank goodness we had plenty of medics right there on scene, as well as a couple of doctors. We were able to get a ET tube, an endotracheal tube dropped, and start CPR, get a couple of rounds of medications on board. We got spontaneous pulses back. She's spontaneously breathing. It's not the greatest. She does have fixed and dilated pupils, which is a not good sign of life. But her pulse is there. She is breathing on her own. So we're going to drive her as fast as we can down to the general hospital, down in Phnom Penh. I'm sorry, down in Port-au-Prince, and see what we can do from there.
Are we like getting ready to go
Yeah, we can go.
with like
Lights
lights
and
and
sirens.
sirens? That's a big meeting. The ambulance, right?
What's this? In the middle of the street. There's a well that's open up in the middle of the street.
I think so.
Everything connected to my phone strings right here. Thank you to the United States Department of Transportation for your paved roads. She's breathing on her own. I gotta tell you, this is what we were talking about.
We've been smoking here for about an hour.
Now you guys want to follow me?
Thanks, guys. Good work. Spontaneous circulation, spontaneous breathing.
So you guys,
We tried to.
It's nice stuff to go back here because the boss is not there. And that place, no?
So we have no ventilators, so this is what somebody's going to have to do. So she
You want to take her to Dartmouth, Ted?
Is there a post-op? Let's take her to the post-op. There's post-op. Hey, we met.
No heart rate. You got no heart rate. Oh, okay, you got something.
CPR.
What do you have? You just called?
We just lost him.
What was that?
We lost him.
What did you say?
We lost him. Doctor.
Thanks, you guys. Thanks a lot.
Pronounce it. It's done.
Do what we can, yeah.
Yeah, you do it. Yeah.
Keep up the good work, thanks. Right.
So here we are at the General Hospital, speaking about the patient that we had just done CPR on. She had initially arrested while we were there on scene at the clinic back in Albury. She went in full respiratory arrest as well as pulseless arrest. We worked her over, started breathing for her, gave her some medicine, as I told you earlier, and she was doing great up until about 5 minutes before we got here to the General Hospital when her pulse started to slow down and we weren't able to get a blood pressure, an adequate blood pressure, as well as her carbon dioxide levels were falling, which is pretty indicative of death starting to take over. We got here to the triage area of the General Hospital and we were able to talk to some doctors. By that time, she had gone into full arrest again. Her heart had slowed down. That wasn't indicative. Was not helpful with life at all, and she had ended up dying. So we ended up bringing her over here to the morgue and offloading her at the morgue. It's a sad state of affairs that, you know, here we are trying to do our thing as medics, trying to save a life, and we're transporting people to the morgue here in Haiti. So this is what it's come to, so thanks.
What's the conditions in the morgue?
The morgues are pretty grim. We didn't see much of it, but when we walked up to the back door, which is where they wanted us to take our patient, they already had 2 bodies laying on the ground. We had to get somebody to come around and unlock the door and drag the bodies inside. They just dragged them off to the side of the door so that we could come in, and we basically offloaded our patient right there on we took the mattress that she was on in the clinic and offloaded her onto the ground. It was so dirty and disgusting in there. It smelled of death. There were flies all over the place. We put some Vicks vapor rub on our lips because the smell is just overwhelming. But that's where we had to offload our patient, our deceased patient at this point. Gave her lots of medicine, helped her breathe, but ultimately she was too sick and she lost too much blood. She died when we got here. Tell him we want to get him connected with someone who's trying to get family members connected. So, are you gonna stay with the ambulance? Okay, we're gonna take him back there and we're gonna try to find other people. We'll be back. Okay. Thank you.